Hi guys, Dr. Arkady with ReBalance. Physical therapy for the penis. What is this guy talking about? How does it relate to the penis? I have physical therapy for the spine, for the joints, for muscles, tendons, maybe vestibular system, maybe pulmonary system to breathe better, vascular system. There's also physical therapy. How does it relate to the penis? Well, let's dissect it. You're absolutely right if you tell me, Arkady, the penis is not a muscle. We cannot do physical therapy for it. And you're right, penis is not a muscle. As a matter of fact, penis consists of a cavernous tissue. Make it simple, it's a sponge. Sponge that's full of millions of capillaries, arteries, and veins. We have some major arteries and veins. The arteries are there to bring the blood in, and the veins are there to keep the blood in. Now, the capillaries are there to communicate between veins and arteries and fill the whole sponge with blood. And that's exactly how we get erected. And that's exactly why with age, we start losing that ability to get erection. Because majority of the cases, the problem with erection has to do with blood circulation. Well, let's talk about blood circulation and how's that relevant to physical therapy. The wall of the blood vessel is a muscle. It's actually a smooth muscle. It has the same function as any other muscle. It contracts and relaxes. Well, it does it to pump the blood. When it contracts and relaxes, it pushes the blood through. When it stops contracting and relaxing, it stops pushing the blood through. So, few things that can happen to blood vessels. Number one, atherosclerosis. What is atherosclerosis? Atherosclerosis is a hardening of the blood vessel wall. In other words, that smooth muscle fills with scar tissue and even some calcium tissue. It deposits there from wear and tear and overuse and of course different toxins that we're exposed to. But the point is, it stops doing the essential function of the blood vessel. It stops pumping. So there's no longer help within the blood vessel. It turns into a pipe. It still carries the blood, but it doesn't assist. Therefore, it doesn't enhance the circulation. With veins, it's almost the same with a little addition. When it comes to erection, the arteries bring the blood in. The veins have to fill up with blood and close the valves to hold the blood in. Otherwise, and I'm sure many of you noticed it, you get erected and all of a sudden you lose it right away without even starting the sexual relationship. So what happens? Well, the veins is just too weak. The valves open up and the blood leaks out. The second problem is internal clotting or internal plaquing of the blood vessel. For some patients, is a lifestyle, an overweight, perhaps abundance of cholesterol, bad cholesterol in the body. For other patients, is problems like diabetes or immune problems, or toxins like nicotine or alcohol, or even the toxins in the air and the water we drink and the air we breathe. So all of those toxins, including some of the internal problems, can cause an erosion inside of the lining of the blood vessel. And that allows that cholesterol to start adhering to the walls and starts narrowing down the veins, arteries from inside. So it closes the diameter of the blood vessel, limiting the amount of blood that can leak through the blood vessel. Third but not least is a problem with smaller blood vessels or capillaries. Small blood vessels are very susceptible to chemical damage as well as some of the internal damages like autoimmune problems or high blood sugar level. And what happens to those walls, they become very thin and the blood vessel collapses. As a matter of fact, with age, we lose a lot of blood vessels, especially those small capillaries. And that's exactly why you probably noticed it, that along the years, you started getting maybe a little weaker erection, maybe the size of the penis shrunk a little bit, maybe the girth of the penis is not the same as it used to be. In general, you cannot hold the erection for as long as you used to hold. So how's the physical therapy can help? Well, when we start treatment of erectile dysfunction, or even a weakness in erection, or even trying to stimulate the ability for you to have a better erection, we have to start first and foremost repairing your blood vessels. And when we start repairing your blood vessels, we usually use shockwave therapy. There's a different video that you can watch that spells out exactly how we do it, the benefits, the contraindications, the indications, and everything else. Please follow our channel. You'll find a lot of useful information there. But when we talk about further rehabilitation of the problem, we need to understand that once we do the work here in the office and we can restore a lot of that circulation, right? We can break the adhesions, so remove atherosclerosis. We can stimulate the formation of new blood vessels, new vascularization to occur at a much higher rate, so you can actually produce a lot of new capillaries and refill the cavernous tissue with blood. But now we need to make those blood vessels stronger. And that's exactly when the rehabilitation comes into play. So the physical therapy is for the blood vessels. We can re-educate the muscles of the blood vessels, the walls of the blood vessels, just like we would re-educate your biceps or triceps or any other muscle to become stronger, to create more endurance for that blood vessel, and to be able to pump at much stronger rate. Therefore, really restore the ability of your body to have a healthy erection. What do we use for that? Well, there's a great news. You can do it by yourself at home. And that's an amazing tool. What we suggest is to use a penis pump. Yes, it may look silly and weird, but it really works, just like any other good physical therapy would work. The penis pump allows you to pump the blood into the blood vessel, so basically expand, right? And by expansion, you will put the pressure on that blood vessel to become stronger. It literally takes 5 minutes. You pump it, you deflate, allowing the penis to keep that erection as long as it does, and then it relaxes, and then you pump again. You do it a few times and you're done. Just like any other exercise, the best is to do it a couple of times a day. You will not believe how well it actually works. It will retrain your arteries to pump the blood into the penis. It will retrain the walls of your veins to keep the blood in the penis and close those valves, seal them so you can actually don't lose erection before you ejaculate. And of course, you're gonna start producing significantly more capillaries because you're pumping the blood into those new, small, young capillaries to become stronger, to be able to fill with blood and birth out. And of course, you're gonna help your body to produce more capillaries and make them stronger as well. Now, if you just have a mild case of erectile dysfunction, or once in a while you don't feel, the same strength of the erection that you used to have, pump would be also very sufficient, because you may not need an actual treatment, with shockwave and everything else that we usually do, especially in the early stages. You can just try to re-enhance it with using a pump. So I hope you find this video useful, and if you do, please like it. By the way, if you have a question what type of pump is better to purchase, we're going to put a list of some of the recommendations in the description of this video. Start your physical therapy today, start pumping, and get stronger. All the best.